And thank you so much, everybody, for joining us today. I know we're all over the area, but I would like to recognize that we are webcasting from and to many different parts of Alberta today. And the province of Alberta is located on Treaty 6, Treaty 7, Treaty 8 territory and is traditional meeting ground and home for many Indigenous people. So thank you.
Yes, thank you. Okay, and then today's topic. So today we are talking about preventive care processes during challenging times, and most specifically COVID-19, because we know that we've all been affected by that. And so our agenda for today, so welcome and introductions. So we'll lead off with that. Then we'll go through our wolf sunsetting and CII CPAR updates as our standing agenda items. Then we'll do a quick introduction to screening and preventive care. And then we'll hear from Amanda, who's here today from the Wood Buffalo PCN, about her experience with preventive care during challenging times. So I'm sure we'll learn tons of awesome tips and tricks from her. And then we'll have a bit of a Q&A and discussion with Amanda and everyone else just to discuss what's going on with you guys in preventive care and if we can share any tips and tricks amongst each other. And then we'll talk about future meetings coming up and do a quick wrap up. So lots on the agenda today. Okay, so an introduction to your EMR User Group Leads. So we have Rhonda, who is a co-lead here today. So she has 6 years of experience with both rural and urban PCNs. And so she's been supporting PMH initiatives. She has a background in emergency medicine and northern medicine for over 20 years. So tons of experience there, which is awesome. And I know I shared this fun fact last time, but for any of you that missed it, fun fact about Rhonda is that she grew up in Alaska. And so she didn't live in an igloo, but she has spent many nights in an igloo just for fun. And I'd say that sounds fun. I would love to do that too. So yeah.
Just for fun. Yep.
Yeah.
Thank you so much for that wonderful introduction. And of course, I'd like to introduce you to Sarah Joy. She has also worked for rural and urban PCNs for over 4 years and then transitioned to the AMA in January 2018, where she's been. And she's been helping all of us with PMH initiatives throughout the years. Very grateful. And she is currently doing her MBA. So I am always learning something new from her. And we just have a really great time. And we thank you so much for being here today.
Yes, absolutely. Yeah, it's been so nice to have Rhonda on board. So it's been wonderful working with you. Okay, so now we're going to do an annotate activity. So like Rhonda said before, if you're joining by phone, this will be a little bit difficult for you, but we encourage you to just throw in the chat an answer instead of doing the annotate, and you'll see what we're doing in a second here. So this is a reminder about how to use the annotate function in Zoom. So at the top of your Zoom window, you should have a control panel, and you should see this here, view options. Right here. And if you click on that, you'll get this menu and you'll see an option to annotate. So if you click that, you'll get this new menu pop up. And on here, you can choose to text things in. You can choose to do a stamp. You can change the color of your stamp. You can also erase it. So for this activity, we encourage you to use the stamp. You can use other things, but the stamp's probably the easiest.
And go ahead and stamp all over this page right now to show us that you are ready and you have found it. Oh, look at that. Look at the hearts and the stars. I love it, love it, love it.
Love it. Yeah. And actually, I take it back. I don't think you can change the color of your stamps. I remember trying that. I don't think you can, unfortunately.
We got check marks and everything. Okay, I'm going to give it a couple more seconds and then we're going to do the activity. So if you're having any problems, and if you are on your phone, you can still do a reaction. And we would love to see that as well. And I think that's good. We can go to the next page. Thank you, everybody. This is the activity. Which of the following best describes your role? And please put your stamp, whatever you want to choose, where it describes your role. If it is other, feel free to put in the chat what that is. I love learning new job titles and descriptions. I love it. So please share that with me.
Mm-hmm.
Look at all those practice facilitators and panel managers. We got a lot of others, so I'm super excited to know what these job titles are. EMR specialist, wonderful. Thank you, Claire.
Mm-hmm. We have a couple. Yeah.
Great, keeping us on our toes. I think that we have an MOA as well. Yeah.
Yeah, looks like it.
Such a great diverse group.
Mm-hmm.
Team lead, perfect. EMR support specialist, great. Practice facilitator. EMR coordinator, thank you. Quality improvement coordinator by title, but include practice facilitation. Thank you.
Mm-hmm.
Lots of different names. All right, that's perfect. Thank you, everybody.
Mm-hmm.
We are going to take this away so that we can make sure we're tailoring these discussions to reach all of you and your needs. So if there's anything that you want to see in the future, put it in the chat at any time, and we'll make sure to take notes. Thank you, everybody, for that activity.
Absolutely. And that's a good point, Rhonda, too, is we don't always know everything that's going on in the field. And so if there's anything that you see coming up, people have questions about things, let us know because we can cover it in a meeting. So that's all. We always love to hear what's going on for you guys. Okay, thank you, everyone. Okay, so let's get right into our standing agenda items. So some Wolf sunsetting updates. So if you would like a TELUS CHR demo, that's the new EMR that TELUS has acquired, you can email healthsales@telus.com. And if you have an urgent request for a demo or they're not getting back to you, just email me and I'll escalate it with the sales team to make sure that they do get back to you. And then an update about the TELUS Collaborative Health Record, or CHR, is that there is a multi-stakeholder group that's been created. So that includes members from the AMA, from AHS, as well as TELUS. And they are working on a plan to integrate the EMR with the Alberta healthcare system so that it can actually function in Alberta. And so as we do these meetings, we'll update you on progress from this group. So right now, all that we know is that TELUS is aware that they do need to start doing more widespread communications about what their plan is for integration. Unfortunately, there are no firm timelines for those communications, but we hope to see those so soon, just so TELUS customers know what's going on and they're kept in the loop. So as those firm timelines come out, we'll make sure that we update you about those at these meetings. Are there any questions about that or anything that you're concerned about?
And I just wanted to add that, Sarah Joy does stay in contact with TELUS regarding Wolf. So she is always getting the most up-to-date information for this group and is happy at any time for you to message her and she'll get direct answers. I know some of you are in a waiting pattern and always wanting information, and Sarah Joy is always there to answer the call for you.
Absolutely. And if I can't answer your question, we have other people at the AMA that can help answer. So you should always get a pretty quick response. So yes, thank you, Rhonda, for that reminder. And my email will be at the end of this presentation. I can also actually just throw it in the chat here for everyone. So you have it. And if you're ever not sure what my email is, you can always email the networks@alberta.org email address and they will forward it to me. So, okay, and then some important dates, just because there has been some confusion about dates, and that's not surprising because there are so many deadlines and dates flying around out there. So we just wanted to make sure that you guys are clear about the dates and not hearing wrong dates, or if you're hearing wrong dates out there, this is the source of truth for you guys. So Wolf is still sunsetting December 2023. That has not changed as far as we are aware. If it does change, you'll hear it from us first, or I'm sure TELUS will communicate it, but we'll make sure that we let you guys know here as well. And then the CII-CPAR 80% goal. So that's the goal to have 80% of primary care physicians in PCNs on CII-CPAR. That goal is May 2023. So that might be a little bit confusing because those dates are both in the same year. And then as well, many PCN business plans are ending March 2022. And so that means that their PIA funding will also be ending March 2022. So Rhonda, I don't know if you want to speak more to that, but I believe that might affect when PCNs want to switch off of Wolf if they are currently on Wolf.
Yeah, I think that there was some confusion with all the dates that are floating around and all the initiatives. And so some PCNs are providing PIA funding to clinics. That's probably only under their current business plan, and majority of business plans will end March 2022. So if it is a Wolf clinic and, you know, that has been a barrier, do I go with a new PIA? Do I wait till I get a new EMR? Do I go on CII-CPAR? These are now your dates to have those guiding conversations of what they should do.
Thank you. Yeah, exactly. Okay, and then CII-CPAR updates. So these data are from November 4th, 2021. So these are current as of last week. And so you can see from this graph where each of the EMRs are in terms of CII-CPAR adoption. So we see Wolf, we have 282 clinics who are not yet participating, but we do have 69 clinics participating, and that's about 20% of clinics. So that's actually fairly high, which is great to see. And then if we break down the Wolf clinics participating by zone, we can see that we've had a huge uptake in North Zone, which is where Amanda's from. I know they've done a ton of work with CII-CPAR, which has been awesome to see. We've had a bit slower uptake in Edmonton, but we do have less Wolf clinics in Edmonton as well. Yes, thank you, Rhonda. Definitely need to celebrate that. Calgary, quite a big uptake as well, so that's great to see. Yeah, and thank you for the stamp, whoever put that in there. Absolutely. Yeah, I see a couple stamps. Nice. Love it. Yes. And if you're interested in having a copy of this data, let me know. I can send it to you in case you want to share it with your PCN or clinic or anything like that. And what I'll do as we move forward, I'll actually show you trends. So next month, I'll show you how the data has changed from this month. I know we haven't been doing that, but I think that would be helpful for you guys to see.
You know what, if you still have your Annotate tool open, you're currently on Wolf and you are on CII-CPAR, if you could put a stamp on here, we would love to see it. We have 28 people here today, and I'm just so interested to know how many we have.
Yeah, we have a couple in North Zone, Central.
Thank you.
In Calgary. I
know, siguro, I just.
Perfect. We have people from all over the place. That's awesome.
Look at this. This is beautiful. Yeah.
Sally, that's exciting. Sally's the new CII-CPAR facilitator in Central Zone. That is awesome.
Congratulations.
Yeah.
Fantastic.
Perfect. Thank you, everyone. It looks like a lot of people on this call are participating, so that's great.
Perfect. Thank you so much.
Okay, awesome. Any questions about our standing agenda items before we move into the main topic for today's session?
Just a lot of congratulations for Sally right there.
Absolutely.
Wonderful.
Yeah. Okay, great. If you do have any questions, you can throw them in the chat and we'll address them at the end here. And if you do have any questions that you want me to forward to anyone like our EMR specialist at the AMA, you can always throw those in the chat as well, and I'll pass them on to her. So she would be happy to answer those. Okay, so let's get into our topic. So I had a bit of a longer intro planned, but I think I'll go through it really quickly so that we can get to Amanda, because that's what we're all excited about. So we'll do a quick intro to what preventative care is. So last week we talked about, or actually 2 months ago now, we talked about panel and continuity. So this is where we were at in our patient's medical home. We were at this level here. Now we're we're talking about organized evidence-based care. So we've moved up a little bit in the patient's medical home. And so here we want to use evidence-based guidelines in our practice and identify patients at risk to ensure that they receive optimal care. So we're hoping that we've established our panels and we have continuity. And now we're going to do some work with our panels, right, to identify patients who are due for screening, for example, or other care. So some examples of preventive care would be lipid screening, HbA1c, so that would be tied to diabetic screening, cardiovascular risk, tobacco use status, exercise status, height, weight, blood pressure, PAP, mammography, and fit. And there are others. These are just examples. And I see a question mark. Is there a question about this slide?
Perhaps exercise status as being preventative screening.
So yeah, exercise status. You know what? I'll go into the next slide because it might help answer your question as we go through this. So the Alberta Screening and Prevention the Alberta Screening and Prevention Program was developed specifically for Alberta. And so we call it ASAP for short. And it's a program that helps clinics to use their panel data. So we talked about that, right? We want to make sure our panels is established. So we want to use that panel data to offer the patients on that panel screening, both opportunistically and through outreach. And we'll talk a little bit later about what those two things are. And so what the program has done is it's helped clinic teams actually design processes that work within the context of their clinic. So these processes might not look the same in every clinic, and they really shouldn't. It's dependent on the context of the clinic. So like I said, it was made in Alberta. It addresses gaps in screening. It aligns with the PMH goals, and it has panel as a foundation. So we're always going to repeat that throughout these meetings. Panel is foundational, right? That's your foundational work. And so what the program did, and this is from 2017, so it's older data, but essentially it shows you what happened when ASAP first started. So the gray bars you see here are the percentage of patients that were being screened before ASAP started. So overall, we had a little bit less than 50% of patients being screened for all of those measures that we saw earlier. And so blood pressure between 60 and 70 and so on. And after a year of doing the ASAP program, we saw increases in screening, right? So overall, we saw an increase of 14% of patients being screened, which is huge. So that's fantastic. And it's increased even more over time. We don't have data for the last 2 years just because of COVID. I wouldn't be surprised if it's decreased a little bit, but that's why we're here today, is to talk about how we can increase it again. And just to address the question about exercise. So exercise is part of the screening program. So actually, let me back up a little bit. These were all chosen because there are other screening maneuvers that you can choose to do, but these were chosen because they are the top screenings that if you do these screenings, they result in the highest rates or the highest decreases in mortality, if that makes sense. Hopefully I'm wording that well. But yeah, they were developed by experts and research from around the world. And so that's why these were chosen. And so exercise was chosen as something that's really important for decreasing mortality. I keep seeing question marks, so I'll assume that they're not actually questions unless you throw a question in the chat, because I'm not sure what your question is otherwise. And one thing that you will see on here is alcohol. So alcohol used to be a screening maneuver, but it was actually removed. And so the reason is that the effort to actually ask people about their alcohol use and the benefits that came from asking those questions it wasn't worth the effort versus the benefit of doing that. So alcohol has been removed since then. And so you'll see changes in these screening maneuvers over time as we learn more and more research comes out.
Thank you, Sarah Joy. That's great. Yeah.
Mhm. Okay, so we talked a little bit about opportunistic and outreach screening. So opportunistic is when we have a patient book an appointment, say they have a cold and they're like, okay, I want to book an appointment and come in to see my doctor. So when the patient actually comes in for their appointment, we can see in their chart, oh, you know what, that patient's actually due for a pap test or they're due for diabetes screening. You actually take advantage of the patient coming into the clinic to complete that screening. So that's what you're doing. You're saying, oh, well, you're here already. Let's do your screening while you're here. So maybe here's a lab rec, or let's book you for a pap test or mammogram. And then outreach screening is what you're doing is you're looking through your EMR, you're finding a list of all of the patients that are due for, say, mammograms. And then you're going through that list and you're calling all of those patients, or you're sending a letter to those patients, or you're sending them a message through the EMR. And essentially, you're outreaching to those patients and asking them if they would like to complete that screening. So that could be, hey, do you want me to send a lab rec to your nearest lab facility? Or do you want me to book you for a pap test? So that's the difference.
I'm so worried some of the people might not recognize that that's a rotary phone. I'll go over that later on what that is in historic perspective. No kidding. Get ready with your annotate activity. We're gonna get you to annotate again on the next screen here.
Yes, absolutely. Yeah, I'll pass it on to you, Rhonda.
Thank you so much. And so I would like to know, and I think we'd all like to know, place a stamp if you think opportunistic has worked best for your clinic, or if outreach has worked best for your clinic. If you can just separate those out and put your stamps where you think they are. Personally, I think opportunistic has been working the best over the last 18 months. But again, I don't have any real data to back that up. It's just conversations. Thank you so much, everybody. Wonderful. You know, it's looking 50-50 to me right now, Sarah Joy. What are you thinking?
Yeah, absolutely. It looks maybe like opportunistic is a little bit higher, but definitely fairly equal.
Thank you for outreach prior to COVID, but now opportunistic. Yeah, hoping outreach can return. Thank you. And thank you, Becerra. Hopefully I pronounced that correctly. Both good. And I know Amanda's going to share with us some tips and tricks for both. So that's great. Thank you so much.
Yes, thank you. Okay, and we're almost up to Amanda. Just one more slide left.
We're building up the suspense, I tell you what.
That's right, exactly. So here, I'll clear all the drawings here. So one of the biggest things that we want to emphasize is that this is teamwork, right? So this isn't just the physician doing this work. Essentially, we don't really want the physician to do most of this work. We want the team to be doing most of this work, right? So for example, we can have, say, the MOA take the blood pressure and measure height and weight. And we can have one of the nurses doing pap smears. And we could have a panel manager actually running lists in the EMR and then doing outreach with patients. So it's all teamwork, right? And who does what depends on your team. It's not going to look the same in every clinic, but it's impossible for one person to carry the load. So definitely distribute it.
Yeah, absolutely. And I get the privilege of introducing our guest today, Amanda Dario. Thank you so much for being here. She is an LPN by background, as you can read, a quality improvement lead for Wood Buffalo PCN. And if you didn't hear, she's experiencing snow at this time. So she started working for the PCN over 6 years ago as a panel manager. And then practice facilitator, and now a QI lead. So a lot of progression there. Very excited to hear about your vast knowledge. You're also supporting other PCNs such as Aspen. I know you have some good friends on here too, and you're leading a lot of groups. So excited to have you here. I can't say enough. Thank you so much. Amanda, take it away.
Thanks, Rhonda, and thanks, Sarah Joy, for having me. And thanks for the wonderful introduction. So just jumping right in. So what does my role as a QI lead entail? So I do have a team in Wood Buffalo with 3 other practice facilitators. I do still support one clinic myself, but most of the work is done by my other facilitators, and I'm just here to help lead the way. Right now, we currently have about 14 clinics that are participating in patient medical home work that we are currently supporting, with 18 physicians working in those clinics. I'm not sure, for those who don't know me, and I know I've talked about it before, our clinics work a little bit different up here. Most of our physicians are solo practice clinics. So our teams within those clinics are quite small. Usually one receptionist, might have a MOA who also supports the clinic. So we really utilize our nurses, which are family practice nurses that are embedded within those clinics, to help support some of the maneuvers that we're working towards. So they help with those screenings to assist those physicians. And then as for EMR, so most of our clinics do currently use Wolf right now. We do have a couple that use MedAccess, HealthQuest, and there's 2 in the community that use Accuro, but again, most of them are on Wolf. So we will be helping them transition once the EMR does phase out. So looking forward to all of that new knowledge and work for that as well. So for our screening, so some of the barriers that we've experienced amongst COVID in Wood Buffalo is the flood that we had happen last year. So we actually had most of our physicians who were in our downtown area relocated. We actually had to create space for them to use our PCN. Again, our PCN doesn't have physicians that work in our clinic on a daily basis. We are just that, just the extension with our multidisciplinary team. So again, having to reevaluate our space to allow the physicians to come in so that they could still see their patients was extremely challenging. Trying to tell physicians they can only have a space for 2 days a week was fun. So we did have to revamp some of our processes that we had embedded in those clinics for, again, to support their patients. So looking at what we could do for outreach or opportunistic screening when they're limited space and limited time within the clinic. So a lot of what we did was, for the patients that did come in, they were presented with opportunistic screening. And then for phone appointments, then it was that outreach. You know, for example, I see that you are due for your mammogram. Can we send a referral so that you can have that done at your convenience without them having to actually come to the clinic? So that's just a couple of examples of what we our challenges within the Wood Buffalo area in the last 18 months. Again, it was extremely challenging. So now looking at how we can improve, as Sarah Joy had said, with the data, I know it was presented from 2017, our screening did decrease a bit. Again, they had limited capacity within their clinics. So looking at how we can support them now to get their screening rates back on that upward trend is our goal for the next little while. So again, really working with my team to look at how we can do that. So what we've implemented is, some of the clinics had been contacting their really chronic patients and then utilizing that as an opportunity to invite them into the clinic and then having their screening done while they were there as well. So that was the big focus for those clinics. And then for our clinic teams, again, working together is a big initiative that we are working towards in Wood Buffalo. We utilize our family practices nurse when and where we can. We, outside of the ASAP screening, we also trained our nurses in the opioid response initiative so that they could work towards that with their physicians as well. And again, inviting those clinics back into the clinic so that they could do those opioid risk screeners with those patients and really do the work that the physicians don't need to do. They can focus on physician work and have really utilizing the team that we have embedded within the clinics. For our clinics that are very limited with staff. We have implemented with them that we, if a patient presents to the clinic, some of the processes that they will capture the height, weight, blood pressure before the physician will see them. If they have a nurse, then the nurse will can also review. We've developed patient panel lists that the staff can pull on a day sheet to see who is due for what screening again, and then reviewing to ensure that they capture the additionals while they're there. Again, we really focus on utilizing the team to their full capacity so that the physician can focus on physician work. And then for the EMR, so what we've embedded within our clinics in the EMR for our screening, there was a lot of trying to find the right. Some fields aren't in a definable field. For example, exercise, and I'm going to go back to that because there was a question around that. So there was no spot that we could actually just search exercise without it being within the SOAP note. Now we all know that there can be typos, there's not a keyword for it. So we embedded an exam form within the charting template to show or to add all of the screening maneuvers. So again, then we had just drop down. So was it completed? Was it deferred? Is that patient exempt, for example? Did they just have a mammogram done? Was their height already completed? So making sure that it was still in a searchable field has really helped us capture that data for our physicians. You know, running those first screening maneuvers and then going back to the physician and saying, well, so I've noticed that you've only screened 10% of your patient panel for exercise, and I ask every patient, okay, but where do you place it? Because if it's in the SOAP note, then we can't find it. So again, making sure that there was a template put in place so that the physician could just add it to their visit in that present time and use a drop-down menu to make that workflow super simple for the physician or the nurse, depending on who is actually charting on that patient at that moment.
That was a great example, Amanda. Thank you so much. Can you just go back to, you said you embedded, was it a form or how did you create that? Sorry.
No, so there is a section under the work desk. So it's an exam field section that we had to go in and we entered all of the information, and you can create the layout a little different. So you could have one just for females, one just for males, or what we've done to make it easier for the physicians, we just created it as one, had all of the maneuvers that would apply to most on a population level. And then the pap and mammogram are down just a little bit lower, just to separate it, so that the physician, if a male was in the clinic, then they wouldn't utilize that space. I also don't mind sharing that after, in case anybody would like to see it. I know that when I had first started, there was an exam template that was sent through AMA when I did my training, but we had revised it and just changed it a little bit, again, to what our physicians would utilize.
Wonderful. I see a couple of EMR specialists would like to reach out to you afterwards to get that workflow. So we'll move on to the next slide here. But yeah, you're going to have some groupies coming out after this.
Perfect. I just dropped my email too in the chat.
Thank you. Thank you.
So a couple of tips and tricks. So when I first started, I wish that Sue was here and I could pull her in. I've had multiple conversations with her. I had a clinic. We were just initiating the ASAP screening maneuvers within the EMR so that the rules were set up. Unfortunately, the clinic manager took it upon herself to put it in each individual chart. It was extremely time consuming. So we had to really review the process of using those population-wide guidelines. So a lot of panel cleanup had to happen. A lot of chart cleanup had to happen. So again, just doing our PDSA cycles and learning that you enter those rules or those triggers through the population guidelines. And then if you have a patient, for example, that has had high grade lesions before through their women's health appointment, that they can actually have a separate rule set up for them individually outside of those guidelines so that they are actually followed up with yearly. And then again, for tips and tricks, so that exam form template, again, I don't mind sharing it. That was extremely useful and time saving, for our physicians and for our staff. We've actually embedded that in our PCN as well. So our multidisciplinary team also uses it so that we can capture for those patients that do present to the clinic to ensure that nothing gets missed. And then we notify the physician as well that screening offer has been made. And then again, for our outreach screening processes, with the flood and with COVID and so clinics being shut down, not doing a lot of virtual appointments, we really wanted to contact our patients and invite them back into the clinic once it was a little bit safer to do so. So again, contacting our chronic patients first and then completing those screenings while they presented to the clinic. It also invited those patients back into the spaces where those clinics had been affected by the flood. So letting them know that their physician office was open. We had great concern that our patients were not going to receive care because they were either didn't know where to go because their clinic was closed, or fear for COVID and everything that had happened when it had first started. So again, really reaching out to our patients and even just as a touch base, hey, just wanted to check in and see how you're doing. Can we schedule a follow-up with you in 3 months' time? And then making note within the chart that those maneuvers were due as well.
Yeah, that's really important, Amanda. Thank you so much for sharing. I do want to highlight, you do have a bit of a transient population where people come up to work in your area and come back. And how do you keep that paneling really clean with knowing that you have those moving populations?
That's a very good question, Rhonda. Thank you. So for our transient population, really reinforcing that process on the front end, that when a patient does present to the clinic, having that conversation of, yes, you're still able to see this physician at this time, but do you have a family physician, say in Newfoundland or Nova Scotia, because they would be responsible for your screening, but you are still able to come and follow up for prescription renewals or whatever the case may be at that time. So again, what we have embedded is those patients get a status applied to them as a temporary patient. And then confirmed patients who do consider the physician their sole provider is an office patient. So we are still able to pull those lists. And then our screening maneuvers are only attached to our office patient status within the EMR. That has also helped with CPAR. So those demographic mismatch reports that come in, we can reach out to the patient, make sure that everything is right if something does come up. But again, really utilizing those statuses to separate those patients.
That's perfect. Yes, many receptionists have told me how much they do not like hyphenated names because you just can't find the patient file sometimes. So. Yep. Yeah, so that is great. And just for interest's sake, out of the 14 clinics, how many of them are on CII-CPAR for you?
So we have 8 right now. We have a few more that are in process. There's one clinic, for example, had switched from Wolf back and then switched to HealthQuest and has now switched back to Wolf. So there was a little bit of delay getting them started, but hopefully they will be going soon. Our PCN and our after hours clinic, which is now temporarily closed, we also had joined for CII. So all of our encounters go within the clinic as well. So.
Wow, really great. I am sure a lot of our people have questions too, and see if Sarah Joy has any as well. Thank you so much today, Amanda. Great information.
Yes, thank you. That was wonderful. So I don't have any questions, but does anyone out there have questions or things to share about some of the struggles that they're having with preventive screening or tips that they have?
Such a great pivot for those doctors, when they must have been doing 5 days a week and to say only 2. Wow. How do you make that decision?
Yeah, it was hard for them, but again, they understood that there was other physicians as well. So rotating them through the clinic, yeah, it was interesting. Thankfully, they are all back in their own space now and doing much better.
That's wonderful. And I'm not seeing any questions yet, but what do you do, Amanda, to keep your cup full in those moments that you have to pivot and you're the change manager of all things? What do you do to keep your cup full?
Lots of things. No, I definitely try to take some time away and, whether it's read or perform a workout. Again, really trying to keep my work-life balance as well. We push that with our physicians. So it's definitely important for us as well.
Yeah, and does your PCN have any fun activities that they do to keep everybody together and spirits high?
Yeah, we do so we do have monthly team meetings, but every second month, then we try to do a team building exercise within our meetings.
That's perfect. Yes. Claire has a question for you. How did you end up becoming a QI lead?
Good question. I have a great team around me, so I am able to provide that support. I really just want to support my facilitators where they are. I am working on the admin side of our PCN with our management team. So I just worked my way up to there. Yeah, we worked with so many physicians. I just want to provide support to whoever I can, where I can.
Natural progression. Wonderful.
Mm-hmm.
That's really good.
I have a great team. My facilitators that I work with up in Buffalo are fantastic. They are great at what they do. So they are easy to support.
Oh, wow. That's huge kudos to that entire team. Hearts all around.
Mm-hmm.
Love it.
And I have a question. So in terms of physicians, I'm sure they're not all super gung-ho to do this extra work maybe in their minds. Like, how have you dealt with physicians who are maybe a little bit more apprehensive, and how do you kind of get your foot in the door with those physicians?
That's a great question. So we did start with our, as you would call, low-hanging fruit. We had really tried to engage a couple of physicians first, and then again ran our PDSA cycles to see how it would work and function in the clinic. And as other physicians started to see progress and hear those success stories for screening rates going up, and we were able to identify some patients and catch, for example, having their mammogram done early. We were able to catch things early enough that these patients have had great success stories. So again, that by doing that, our physicians, our other physicians were eager to take on that initiative. Our physicians also are great. We have a great working relationship with all of our physicians. We have a few that when we walk in the door, they say, "So what's the new thing today?" Because again, they're so engaged now in this patient medical homework that they want the next initiative. They want to know what's coming next. So they're really, really engaged with our team.
That's great. And go ahead.
No, so I was just going to say, for some that are a little bit harder, we just, again, still try to really build that relationship within the clinic and share our stories of success and hope that they will take that step to engage with us. All of our physicians that we are currently working with do work towards the ASAP initiative.
That's wonderful. And I love that you brought in relationships, because that's key, right? Yeah.
Relationship building is so important.
Absolutely. With anything, right? So, yeah. Has anyone on the call had trouble getting physician or even clinic team buy-in to do preventive care or other barriers?
Well, this one is for you, I believe, Amanda. What's the funniest wording used for charting of screening? I find physicians use so many words. DLD, done like dinner, once patient discussed screening. So what have you seen?
A funniest word. I might have to think about that one for a little bit. However,
Claire, I really like that, Claire. DLD.
it is pretty funny.
Yeah, if you're trouble getting buy-in, you can always suggest something like that.
Yeah, it's hard when they use different words, or if it's in a definable field, trying to find those maneuvers or where they were completed. You know, those documents that get scanned and linked, and instead of having mammogram with a drop down, and you actually find that they have 63 different ways that it's been entered. So changing that process to ensure that they're just using those drop down keywords.
Yeah, and when that happens, do you find you usually just change the processes moving forward, or do you do the cleanup going back to change the wording? What do you find works?
So we originally had started just to go forward. This is how we will use it. And that seems to work a lot better. Again, some of our clinics are lower staffed, so it is harder to go back. If we have the capacity, our facilitators will help do some of that background cleanup. But again, we just really try to focus on going forward.
Yeah, and that makes sense in a lot of cases, right? Because the intervals for screening are so short that eventually you'll get to a point where all of your data is clean that you need. So yeah.
I see another comment in the chat here. I want to say it's from Michaela. Something that acts as a speed bump is the initial paneling process prior to starting ASAP screening. Lots of physicians take a long time to review their panelists. And I know I experienced this, and I like to do panel cleanup in December. I always feel like cozying up in front of a Christmas tree with your panelists is a great time to get your highlighter out and just look it over. I'm trying to sell it. I'm on year 6 of trying to sell this, but that is my goal.
Yeah, and it does take time. I don't know what year we started paneling in Alberta, like the initiative, but it's been a lot of years and we're still working on it. So it does take time. Yeah.
Mm-hmm. Anything you wanted to add, Amanda? Anything that you thought of?
I don't think so. But again, if anybody has any questions or you want to reach out, feel free to message me. I'd be happy to answer any questions.
Yeah, and I know, so someone said 2014 is when their PCN started the paneling process. So that would be about 7 years. So yeah, it does take a lot of time.
And Vanessa's wondering if anybody could speak towards worksheets in Wolf. She believes that's what they're called. Amanda, do you have any experience with worksheets in Wolf?
I don't.
No.
So yeah, so actually, you know what? I'm going to share a quick slide here. So you guys keep chatting or don't chat while I look for it, but I do have a slide on it, so I'll find it for you.
Perfect.
And
Good
what we
luck
can
with the snowstorm, Amanda.
Yeah.
I'm
Yes.
hoping that it's stopped. I need to travel on the highway this afternoon, so I'm hoping.
Oh, we'll all send you good vibes of travel for sure.
Okay,
Yeah,
and
thank you for that, Vanessa. Sarah Joy's just going to bring that up on worksheets in Wolf here.
Yeah, and if I can't find it, what I'm thinking might be useful, and you guys can let me know, you can, oh, and I see that this stopped presenting here. So if you want to annotate on here, if you would like this, in the new year, we're still planning our topics. If you want to have a meeting specifically on how to use Wolf for preventive screening, so things like how do you create an exam template, how do you create a worksheet or a flow sheet, sorry, all of those, throw an annotate or something in the chat to let us know that that would be of interest.
And Sally has stepped up to help with flow sheets. So he wants to reach out to Sally too. Amanda, you were talking about flow sheets as well, I believe.
No.
And I did find the slide that I was looking for here.
No.
So this is what flow sheets look like in Wolf. So this is a custom worksheet that was created for ASAP screening. So they're really useful. You just right click in Wolf and you can hit flow sheets, and then you pick the flow sheet you want up here. There's some that have been created in Wolf. You can create your own as well, like this one. And it's cool because for each one you can have targets. So for example, hemoglobin A1C, say we want that done every year. You can set that as a target and see, oh, this is overdue at a glance. And then you can see their most recent result for each one. And you can see all of the previous results as well here. So it's a nice at a glance to see what's happened for this specific patient. So yeah.
Thank you so much, Sarah Joy. Always learning from you. Always.
No worries. I actually created this one for North Zone. So yeah, came in use here as well. So that was good timing. But yeah, I think Rhonda, yeah, we'll look at doing something like that in the new year to give you guys some specific tips and tricks in Wolf.
Have any other questions? Please put them in the chat. And Sarah Joy's just going to walk through
yes,
care tools and where you can find them on.
Absolutely. Thank you, Rhonda. So if you go to our website, the banner at the top, if you go to Patients Medical Home, there's this drop down that comes down and a ton of options. But if you head down to that organized evidence-based care section, there's more information on the Alberta Screening and Prevention Program, as well as the ASAP Plus program. So we didn't talk about that today, but that's in addition to the ASAP program. So it has things like talking about nutrition with your patients. I think alcohol is in there as well, and a couple other things. So I'd encourage you to go take a look at those web pages to find out more. And there's lots of tools on there as well for you to use. And then something else, and this is not the greatest picture, but if you go to our website and go to the PMH change packages. So actually, if I go back here, go to this section here. It's under capacity for improvement, and then click on PMH change packages. It'll take you to this website here. And at the bottom, we have these change packages. And if you click on the screening and prevention one, it'll take you to a change package that'll walk you through some processes that your clinic can try out to help you with screening and prevention. So that's a really useful tool there. And if you have any specific questions, please reach out. And I know Sally said that she's willing to help with work or flow sheets. So go and you can reach out to her about that. But if you have any other questions, please feel free to reach out and we can either cover it in a future meeting, or I can find you someone to help out on the user group. So yeah, because we are here to help with any of those processes.
And in saying that, you know those MOAs, you know those clinic managers, you know the people doing the work in the clinic, they are more than welcome to attend these meetings. We'd love to see them here, and we'd love to hear their questions and help them. Nobody is working alone right now. We're all working together.
Absolutely. Yes. Thank you. Yeah, that's the point of this group, right? Is to connect people. So absolutely. Okay, so next webinar. So we have our December 8th webinar already planned. So that will be from 12 to 12:30 p.m. So a shorter meeting. And we'll just be focusing on our standing agenda items. So that's TELUS and CII-CPAR. We do have some updates in terms of CII-CPAR workflows, especially for sending consult reports. So stay tuned or come to that meeting if you want to find out more. And then stay tuned for 2022 meetings. So I think Rhonda and I will look at setting something up for using worksheet or flow sheets. I keep calling them worksheets, flow sheets and exam templates for preventive screening. And we are also looking at having someone come in and talk about transitioning from Wolf to another EMR. So talk about their experiences doing that, because I know that's probably top of mind for a lot of people right now. Yeah, absolutely. And as we've said before, if there's anything else that you're interested in talking about, any questions that you have, tips or tricks you want to share, please email me, and we'll make sure that we get whatever questions you have answered, or we touch on anything else that you want to talk about in these meetings. And thank you, Claire. So nice to have you on here.
Huge thank you to Amanda for coming in today. Safe travels as you go, and look forward to all those emails you're getting right now.
Absolutely.
Thanks for having me.
Yes, thank you so much, Amanda. This was so helpful.
Thank you, everybody, for joining us today. Please message us anytime. We're here. You're not alone.
Yes. Yeah, even if you just want to troubleshoot something, you're like, I don't know what to do in this situation, we are here. So please reach out. And don't forget the discussion board. That's a really good way of reaching out to other people on this user group. If you have a question or you need help with anything, that's a really good way of reaching everyone on this in this group.
And if you want to present like Amanda did today, feel free to message us as well. I know you have some tips and tricks out there. I know you have some nuggets of knowledge that I want to explore. So please message us.